at the effectiveness of subliminal therapy is not just a subjective impression of yours or of others. We actually did a study, a clinical study, and the study showed that for many different kinds of problems, there were 2 to 7 sessions of 1 hour being needed. The average 3.5 sessions, 3.5 sessions. And you told me you are planning, or there is a huge study being planned in Mexico. And can you tell me about the study?
I don't have full information, but the impetus resulted from my teaching this method in Mexico to people who turned out to be in influential positions down there. And now the Mexican government is instituting this, I don't at this point really know how big, but a major controlled study. I will be going down there to train the psychologists who will be treating patients on the common problem of addiction. Now, they are focusing on drug addiction. My experience in my private practice with addiction, it has proven to be the most effective area treated, higher success rate in addiction than in any other problem. And that includes chemical addiction and non-chemical addiction. Now, we speak of gambling as an addiction. We speak of being addicted to another person. These are very real addictions. And I've concluded that the essential element of all addictions is the psychological component.
So there's a common denominator between chemical and non-chemical addictions.
Yes. See, the body will metabolize the chemical agents of whatever drug is being abused. It takes time, different times for different agents. Tobacco smoke, about a week. Heroin, who knows, longer. But once the chemical agents have been metabolized, they're no longer existed in the person's body if he's totally detoxed. Still, that uncompromising compulsion to use is still present. Well, that's a psychological problem. And as a psychological problem, it needs to be addressed psychologically.
Your concept of addictions is unique and it differs from the medical model.
Gets me in trouble regularly.
And I just heard the common denominator is actually the urge, the compulsion to use whatever the person is using.
Yes. The medically oriented person would respond to that. Well, what are you talking about? Withdrawal, tolerance, these are real factors, and of course they are. You've ignored those. Well, in a sense I have, but even withdrawal, fear of re-experiencing the withdrawal phenomena. People on drugs will do anything to avoid that experience. That fear is absolutely the driving force. Again, we're talking about a psychological factor, the fear. And by engaging in this method and maybe in addiction, hypnotic influence, more of a direct kind. You know, we can pretty well mask the symptoms of withdrawal by hypnotic suggestion. Do a better job of it than we can with medication for most people. That's not generally known, but you know it, I know it. So more direct hypnotic suggestions can ease the process, but in the end, that underlying core force, that part of the mind or combination of parts. See, when we speak of a problem, whether it's depression or phobia or whatever, there's an original initiating experience. But there can be reinforcing ones as well. There can also be others that ease it. But in unfortunate cases, the same kind of experience related in some way reinforces that first lesson. Well, you have to identify every one of these. And when they all have been identified and resolved, patient's through with it. Doesn't exist. The problem, the presenting problem, is as though it never was there. That's the test of success. That's the measure of success that I use in measuring the success rate. Not just easing, not just making the, reducing the intensity of the headache, but eliminating the headache. That's needs to be the goal of psychotherapy.